The year is somewhere in the 2nd century. You are standing on the Subura, Rome's loudest street, the one that never fully sleeps, and a cartwheel the width of your arm span catches you across the side of the head. Not a glancing blow, a full, committed strike. And in the next few seconds, your skull is going to do something it was never designed to do, and the people around you are going to have to decide, with their hands and their eyes and nothing else, whether you live through it. That is not a metaphor. That is a medical situation. The first thing you notice is the sound, not the impact, the sound inside your head, a low, wet crack that you feel in your back teeth before you feel it anywhere else. Then the ground, then nothing for a moment that has no edges. When the edges come back, they come back wrong. The light is too sharp. The noise of the street is somewhere else, behind glass. You are on your hands and knees and you do not know how you got there, and the blood coming down the side of your face is moving faster than blood should move because the scalp, that dense mat of vessels sitting just above the bone, bleeds the way rivers flood. Immediately, completely, with no warning and no shame. A scalp wound on a living person looks like a killing wound. Roman physicians knew this. The Greek physician Galen, who spent years treating gladiators in Pergamon before moving to Rome around 162 AD, wrote about the difference between what a head wound showed you and what it was actually doing underneath. The surface lied, the surface always lied, so the people around you matter now. And in Rome, who you are determines who reaches you first. If you are a gladiator, there is a physician on contract, a medicus, standing inside the arena before the bout ends. Galen held exactly this role at the gladiatorial school in Pergamon, and he described it without sentiment, as a job, as a problem to be solved in the dirt with instruments and speed. If you are a soldier on campaign, the Roman legions carried trained capsarii, wound dressers who moved through the field and learned fast because the alternative was learning nothing at all. If you are a laborer on the street, a slave, a tradesman with no patron and no rank, you wait for whoever stops. And in a city of 1 million people, someone stops. But what they know and what they carry and how much time they spend with you before they move on, that depends entirely on what you were worth before the wheel hit you. The physician who reaches you does not have what you would reach for. No imaging, no pressure gauge behind the skull, nothing that sees through bone. What he has is his hand, a probe, and a theory of injury that Hippocrates laid out in a text called On Head Wounds, written in the 5th century BC and still being copied and consulted in Rome 600 years later. The theory held that skull fractures came in kinds: a simple linear crack, a depressed fracture where the bone had been driven inward, a contrecoup injury, the bone broken on the side opposite the blow, which Hippocrates described, and which still carries his logic in modern trauma medicine. The physician presses his fingers into your scalp, feeling for the give that means the table beneath has dropped. He parts the wound with a probe, not brutally, but without hesitation, because the thing that kills you may not be the thing you can see. And here's the part that made Roman head trauma its own particular cruelty. Some men walked away, some men spoke clearly, identified themselves, asked for water, and died 3 days later in a room with no one watching. The Romans had a phrase for the interval, the quiet time between the blow and the collapse, but they did not fully understand what was happening beneath it. What was happening was bleeding, a slow arterial leak between the skull and the membrane beneath it, building pressure in a space that has nowhere to give. The brain does not expand outward. It has no room. So the pressure finds the brain itself, and the brain, pressed, dims, and then stops. The physician in 150 AD had no way to see this. He had only the behavior. A man who improved and then worsened. A man who slept too deeply. A man whose pupils had stopped agreeing with each other. These were the signs Galen described, and they were right, and they were not enough. So the first interventions begin. Clean the wound, cut back the scalp to see the bone itself. Run the probe along the crack and feel for depth. Pack the edges with lint soaked in wine, which is not surgery but is not nothing. Vinegar and wine carry a weak antiseptic action, and Roman practitioners use them both as a matter of course. And then the decision that divides the cases that stabilize from the cases that require something far older and far stranger than anything else Rome would offer you. Whether the bone itself must be opened. Whether the only way to save you is to go through the one structure that was built specifically to make that impossible. The instrument is called a trepan. It is a circular drill, a rotating cutter with a fixed central pin to stop it going too deep. And the Romans did not invent it. Hippocrates described the principle in the 5th century BC. Skulls with the circular marks of trepanation have been found in Neolithic graves tens of thousands of years before Rome existed. The procedure is, in that sense, one of the oldest things medicine ever tried. What the Romans added was not the drill. It was the argument for why. Aulus Cornelius Celsus, writing in the 1st century AD in a medical encyclopedia called De Medicina, set down the logic in plain terms that survive intact. You press the bone. If it gives, or if fragments have been driven inward, the fragments must come out. Not because cutting bone is obviously good, but because what the bone is doing to the tissue beneath it is worse than the cutting. A depressed fragment pressing against the dura, the membrane sheathing the brain itself, causes what Celsus called corruption. The pressure, the trapped blood pooling in the dark between bone and membrane, the heat of a wound beginning to turn on itself. These were the enemies. The trepan was not the treatment. The trepan was the door to the treatment. Galen agreed in the way Galen agreed with things, which is to say at length, and with himself at the center of the reasoning. He had seen what happened when fragments were left inside the skull. He had watched men survive the blow and die of the quiet afterward. That slow interior pressure, building behind a face that still looked like a living man's face. He understood, without the vocabulary to say it cleanly, that the skull is a closed box, that anything accumulating inside it has nowhere to go except through the brain, and that the brain pressed hard enough simply stops. So you open the box. You remove what is pressing. You give the corruption, the blood, the trapped fluid, somewhere to go. The logic is not wrong. That is what makes it worth sitting with. Here is what the procedure physically meant for you. You are conscious for part of it. The drill bites through the outer table of the skull, the hard cortical layer, and the sensation is not like anything that has a name yet. The physician works in stages, Celsus wrote, stopping frequently to clear the bone dust and check the depth, because the central pin of the trepan is the only thing standing between the cutting edge and the dura beneath. Go too far, and the instrument that was meant to relieve pressure creates it. The line is a millimeter, sometimes less. The physician is working by feel, by sound, by the change in resistance as the outer bone gives way to the diplo, the softer cancellous layer in the middle, and then the inner table beyond. He stops before the inner table fails completely. He levers out the fragment. And then the wound is open to the air in a way a skull was never designed to tolerate. What sometimes worked, removing a genuinely depressed fragment that was mechanically pressing on the dura, could relieve the pressure causing a patient's deterioration. There are Roman-era skulls in the archaeological record that show healed trepanation margins, bone that grew back in the months after the surgery, which means the patient lived long enough for the bone to respond. Not many, enough to confirm the operation was not universally fatal. What did not work and could not work was any case where the real danger was already epidural bleeding, that slow arterial leak pooling between skull and dura that caused the quiet interval described in the previous hours. The trepan could, by chance, drain such a hematoma if placed correctly. It could also miss it entirely. The physician had no way to know which he was dealing with. He was reading the surface of a problem that lived underneath the surface the same way the tracker reads the bent grass and not the animal itself. And then infection. Bone is not skin. Bone does not seal quickly. An open craniotomy in a world without sterile technique, without the concept of sterile technique, was an entry point for everything the Roman street carried. Fever came first, then the deep organizing pain of bone beginning to die. Osteomyelitis, the infection of the bone itself, moved slowly and killed by degrees over days or weeks, not the fast arterial catastrophe of the blow, but a long withdrawal, a man growing quieter and hotter and then gone. Seizures marked some cases in the aftermath, the damaged cortex firing wrong, the body suddenly outside its own control. Disability that was permanent. Weakness down one side. Speech that came back only halfway. Vision that narrowed and stayed narrow. Survival with the shape of the damage still worn in the living body. Non-intervention carried its own ledger. Leave a depressed fracture in place and the fragment continues its pressure. The brain beneath it scars. The seizures come anyway, weeks or months later in a man who thought he had recovered. Leave the epidural bleed untouched and the quiet interval ends on its own schedule, not yours. There is no clean column for wins. There is only a physician, trained in a tradition stretching back to Hippocrates, standing over a body he cannot see inside, using tools that worked on the principle that something bad outside the brain was better than something bad inside it. Celsus wrote it because he believed it could be reasoned through. Galen practiced it because he had watched enough men die of the alternative. So come back to the street, the cart, the wheel. You on the stones with the blood already moving down your face faster than it should. The physician who reaches you is not ignorant of what he is doing. He is doing the most coherent thing available to him, inside the limits of what a human being in the 2nd century could know, with his hands and his probe, and the doctrine of a man who watched skulls break 500 years before he was born. The horror was not that they tried. The horror was how thin the distance is between a careful man doing his best and the thing he cannot see, the pressure building in the dark just beyond the reach of everything he knows.